Polycystic kidney disease (PKD) is a genetic disorder, renal disease. Look at this: normal kidney and polycystic kidney. CT findings, MRI, and ultrasound findings. Look at this. Detail going on. Introduction. Polycystic kidney disease is a genetic disorder characterized by the development of numerous fluid-filled cysts in the kidneys. These cysts gradually enlarge, causing the kidneys to increase in size and lose function over time, related to kidney failure in some cases. Definition: PKD is defined as a hereditary condition in which clusters of cysts from primarily within the kidneys, causing them to become enlarged and eventually lose function. The cysts are non-cancerous but can lead to significant health issues due to kidney enlargement and impaired filtration capacity. Types: 1. Autosomal dominant polycystic kidney disease. The more common form of PKD, accounting for about 90% of cases. It usually manifests in adulthood, typically between the ages of 30 and 40. 2. Autosomal recessive polycystic kidney disease, a rare form that often appears in infancy or early childhood, leading to more severe complications including liver problems. Causes: PKD is primarily caused by genetic mutations in the PKD1 and PKD2 genes cause ADPKD, while mutations in the PKHD1 gene are responsible for ARPKD. Risk factors: 1. Family history. Having parents with PKD significantly increases the risk. 2. Genetic mutations. Inherited mutations in the PKD1, PKD2 or PKHD1 genes. 3. Age. Symptoms usually become evident between age 30 and 50 for ADPKD and much earlier for ARPKD. Complications: 1. Chronic kidney disease. Progressive kidney damage can lead to CKD and eventually kidney failure. 2. High blood pressure, one of the most common complications even before noticeable kidney damage occurs. 3 kidney stones acquired due to abnormal kidney function. 4 liver cysts, especially common in people with AD-PKD. 5 aneurysms. Brain aneurysms may develop due to weakened blood vessel walls. 6 heart valve abnormalities. Mitral valve prolapse can occur. 7 infections. Kidney or urinary tract infections, UTIs, can develop. Pathophysiology. PKD results from mutations in the genes responsible for kidney cell function. These mutations causes the epithelial cells in the kidneys to proliferate abnormalities, leading to cyst formation. As cysts grow, they compress surrounding kidney tissues, reducing their ability to filter waste from the blood, ultimately leading to kidney damage and in some cases failure. In ADPKD, the gene mutations affects proteins involved in cellular structure and signaling. In ARPKD, the defective gene affects the development of both kidneys and liver. The pathophysiology of polycystic kidney disease can be broken down into the following step-by-step process. 1 genetic mutation, 2 abnormal cell function, 3 cyst formation, 4 fluid accumulation in cyst, 5 compression and displacement of normal kidney tissue, 6 progressive loss of kidney function, 7 other cystic effects. The overall process involves genetic mutations that cause abnormal cell proliferation, cyst formation, and progressive damage to normal kidney tissue, leading to the gradual loss of kidney function and systemic complications such as hypertension, aneurysms, and other organ involvement. Signs and symptoms. 1 abdominal pain or back pain due to kidney enlargement or cyst rupture. 2 high blood pressure, often the first sign. 3 blood in urine caused by cyst infections. 4 frequent urinary tract infections, especially in the kidneys. 5 kidney stones cause pain and bleeding. 6 fatigue due to kidney function decline. 7 swelling, fluid retention may occur in later stages. Diagnosis. 1 ultrasound, the most common imaging technique used to detect kidney cysts. 2 CT scan or MRI. These imaging modalities can provide more detailed images of the kidneys and cysts. 3 genetic testing can identify mutations in the PKD1, PKD2, and PKD1 genes, confirming the diagnosis. 4. Blood and urine test used to assess kidney function and detect any signs of infection or blood in the urine. Nursing diagnosis. 1. Risk for impaired urinary elimination related to cyst growth and kidney dysfunction. 2. Chronic pain due to the pressure exerted by cyst on surrounding tissues. 3. Risk for infection due to presence of cyst and possible urinary stasis. 4. Fatigue related to decreased kidney function and chronic illness. 5. Fluid volume excess related to decreased kidney function leading to fluid retention. Management and treatment. A. Lifestyle modification. Low sodium diet to manage blood pressure. Regular physical activity to promote overall health. Adequate fluid intake, especially in preventing kidney stones. B. Medications. Anti-hypertensives to manage high blood pressure. Pain reliefs to alleviate discomfort from cysts. Antibiotics for treating infections such as UTIs. Tolvaptan, a drug that slows the progression of cyst development in ADPKD. C. Dialysis or kidney transplant. In advanced cases of kidney failure, dialysis or transplantation is required. D. Surgical interventions. Drainage of infected cysts. Surgical removal of large cysts if they cause pain or obstruct other organs. Psychosocial medicine. PKD can have a significant emotional and psychological impact on patients and their families. Living with chronic progressive illness can lead to feeling of anxiety, depression and helplessness. 1. Counseling can help patients cope with the stress of managing a long-term condition. 2. Genetic counseling advisable for families as PKD is a hereditary condition. 3. Support groups, peer support and information sharing. Prevention. While PKD cannot be prevented due to its genetic nature, early diagnosis and management can help delay complications. Regular checkups, blood pressure control and maintaining a healthy lifestyle are crucial in reducing the progression of kidney damage. Early finding by one genetic testing identifying mutations in families with history of PKD. 2. Early diagnosis, regular screening in at risk individuals can help manage symptoms early. In conclusion, polycystic kidney disease is a complex genetic disorder that can lead to significant health issues particularly kidney failure. Early detection, appropriate management, and supportive care can help patients manage the symptoms and complications of PKD, improving quality of life and slowing disease progression. Thank you. Have a nice day.